Well, forget taxes and the president's health care law. Next time you visit the doctor, you're going to get hit regardless. A new report from the Institute of Medicine is urging now a 2% tax on folks with private insurance and Medicare, so we can essentially double public health spending in America. This is not what Dr. Sreedhar Potarazu ordered, but it is what he predicted, that if they couldn't gouge you one way, they'd find a way to gouge you another way. Doctor, good to have you. Is this already baked into the cake, or what? What's happening here?
I don't think it's baked yet, Neil, but I think that this is the preparation for what's going to happen probably by the end of June, with the expectation that the Supreme Court overturns the mandate, and they've got to figure out some means of being able to impose consumers to still pay this tax and still be able to fill the enormous hole that's been created by the law. So I think that the government and all of the related parties are scrambling right now to figure out what Plan B is, because the president clearly stated, last week that there was no alternative, and I think they've got to come up with one.
Well, I think you just brilliantly hit the nail on the head on this one, because I think people are the opinion that you take the mandate out, it's dead. It is not dead. It still lives on. I mean, there's still going to be a Medicare-related tax hike on when you sell your home. There's a surtax for that goes to Medicare. There are all these other fees that are tangentially related and rolled out in 2013 and 2014. So unless the whole law is shot down, cutting the mandate isn't going to cut it, right?
Yeah, that's exactly right. The mandate can go, but the rest of the law can still stay in place. It's the whole issue of severability. You know, the CBO and others will argue, of course, that yesterday there was a report that came out that said that the predicted deficit is in fact closer now to about $340 billion, which is well over the initial estimate. But the even greater irony here, Neil, is the whole notion that a tax can be used to create an incentive. There's nothing in the history of the United States where a tax has incentivized anybody to do anything. And if the intention here is to get consumers more engaged in getting the preventive services that they need, it's an oxymoron to believe that you can instill a tax in order to motivate individuals to do that. It will do, in fact, just the opposite. So that's, a complete contradiction in the statement and the hypothesis. And
it's also affected the psychology of healthcare providers, right? I know many a doctor who have really questioning now, well, maybe I'm not going to recommend this MRI or not going to recommend this scan because I know there will be those policing the recommendations I make and whether I'm willy-nilly just wasting money or whatever. So I'm going to be conservative in this, and even if I have my doubts, I might go slow on this. How serious is that, and how beyond the Supreme Court ruling, how big could that be?
That's an excellent point, actually, because also in the last few days, you have a very large group of physicians that have done just that. They've come out and said that we collectively are going to make recommendations about, in fact, ordering less tests and coming together to create a mandate that says that we're going to be, a lot more discretionary, especially around the examples of doing CAT scans or MRIs for, let's say, somebody that comes in for a headache into the emergency room. So you create a dichotomy here where you're trying to impose a tax to get in consumers to go and see the doctor more, but you've got the pushback from the medical community that says, wait a minute, here we are, we're not getting any incentive. In fact, we're getting punished for doing unnecessary tests. We're going to be more judicious. And so the statement by the Institute of Medicine creates a real contradiction to where the medical community is starting to come out in terms of saying that, look, we probably want to do less than more.